What made me choose to become a doctor? Well, actually, when I was at school, I really enjoyed science and I wanted to become a lab researcher. And I was always advised to try and get a medical degree because it really broadens your horizon for lab research. But when I went to medical school, I soon realized I just loved that kind of one-on-one with patients, being able to help people individually, being able to kind of give back to my community, and really to combine all of that scientific and academic learning with practically being able to help. So, by the time I finished medical school, I'd soon realized I wanted to become a fully fledged doctor. Um, I really wanted to do cardiology ever since I was at medical school, actually. I think the moment I was first sold on it was when I went into the operating theatre and just saw a live heart, and just this amazing thing of having this live heart within all of us that's beating away, and hopefully most of the time we don't even notice it. Fortunately, in my job, one of the things that I do is heart imaging. So I'm lucky enough to see live beating hearts every day, and really understand the process, and also help out in theatres when needs be. I think another thing that I really enjoy about being a cardiologist is just the variety of things that I see, all the way through from people who want to have healthy heart checks, to people that are really unwell with discomfort in their chest or palpitations, all the way through to athletes wanting to get exercise testing or to push themselves further. And it's just all of that variety that it really helps to keep me enthusiastic. I mean, that has to be helping people. It has to be seeing people really understanding their problems, working through them with a solution, and just being able to help them. I think the other side of it is that it's really kind of intellectually satisfying as well. That the medical field is constantly updating and keeping abreast of the latest techniques and the research and the advances. That there's always something new to be learning every day. What do patients value about me? Gosh, well, I'm lucky enough to have plenty of feedback from my patients because I'm always asking patients for feedback. And I think one of the things they consistently say is that I really take the time to understand what's going on with them as a person, rather than just seeing the heart as a condition and saying, oh, well done, you don't have this condition, that or the other. I try and always take things one step further and actually figure out, well, if it's not something serious, well, what actually is it and what's going on? And patients consistently feedback that they really appreciate the time that I take to actually solve the concerns that they have. Yeah, I've kind of mentioned a little bit about what I really get back from patients is just that brilliant feeling of patients coming in saying, I had such a problem and now I've seen you and it's really gone away. Or even better, that they now feel in control of their condition and able to manage it. And just I've been lucky enough to kind of train all around the country, from kind of down south in Oxford and Cambridge through to more rural areas, and then finally settling down in Leeds. And wherever I go, patients are so their problems are so similar, and there's a lot of themes underlying things, and patients almost invariably are always grateful and helpful and just lovely when you take the time to help them. What is my mantra for patients? Well, I don't have a specific mantra that's going through my head, but I think if there's one theme that I always try and uphold myself to, it's to empower the patient to get better. Whenever I'm seeing a patient, I'm thinking about what their problem is, but in terms of the solution, I'm always trying to think one step ahead and say, really oftentimes I'm trying to use medicines as a bridge to allow the patient to get themselves better. If a patient has a problem, perhaps they'll be able to get better by themselves with the appropriate education and understanding and knowing what's going on. Perhaps they need medicines as a bridge to allow themselves to get better, or perhaps even they need to have medicines long term, but at very least I can give them the understanding of what's going on and what they're doing and why these medicines are there to help them. And similarly, if they need to have procedures. Really, I see myself as kind of the assistant to try and help people get themselves better and starting and helping them through that process.